Hello everyone and welcome back to our channel. Today, we're diving into a topic that affects millions of people worldwide, dementia. Dementia is a condition that can impact memory, thinking, and behavior, and it's essential to recognize the signs early on. Memory loss, disorientation, language problems, impaired judgment, mood changes. Whether you're a caregiver, a family member, or just someone who wants to learn more, understanding these signs is crucial. By knowing these signs, you can help identify dementia early, seek proper medical care, and provide support to those affected. So stay tuned as we explore each sign in detail, share personal stories, and provide valuable insights from experts. Dementia is a general term used to describe a decline in cognitive function severe enough to interfere with daily life. It is not a specific disease, but rather a group of symptoms associated with a decline in memory, reasoning, communication skills, and the ability to perform everyday activities. Dementia is caused by damage to brain cells, which impairs their ability to communicate effectively with each other. Here are 10 common signs of dementia. 1. Memory loss. Forgetfulness that disrupts daily life, such as forgetting important dates or events, repeatedly asking for the same information, or relying on memory aids more frequently. 2. Difficulty. Performing familiar tasks. Struggling to complete tasks that were previously routine, such as cooking a meal or managing finances, even though the steps involved are familiar. 3. Disorientation. Getting lost in familiar places. Experiencing confusion about time, dates, or locations, or forgetting how they got to a certain place. 4. Language problem. Difficulty finding the right words. Trouble following or joining in conversations, or using inappropriate words or phrases. 5. Impaired judgment. Poor decision-making, such as giving large sums of money to telemarketers, neglecting personal hygiene, or disregarding safety precautions. 6. Mood and personality changes. Changes in mood or behavior, such as becoming irritable, suspicious, fearful, or anxious, often without apparent reason. 7. Difficulty with abstract thinking. Struggling with tasks that require abstract thinking, such as understanding jokes or sarcasm, handling complex finances, or following a recipe. 8. Withdrawal from social activities. Losing interest in hobbies, social activities, or previously enjoyed pursuits and becoming increasingly isolated. 9. Misplacing items. Putting things in unusual places and then being unable to retrace steps to find them, such as placing keys in the refrigerator. 10. Decline in problem-solving skills. Difficulty with planning, organizing, or solving problems, such as forgetting how to play a favorite game or losing track of steps in a familiar process. It's important to note that experiencing one or more of these symptoms does not necessarily mean someone has dementia, as many other conditions can cause similar signs. However, if you or someone you know is experiencing these symptoms, it's essential to consult with a healthcare professional for a proper evaluation and diagnosis. Meanwhile, there are many different types of dementia, with Alzheimer's disease being the most common form. Here are some of the most common types. Alzheimer's disease. This is the most common type of dementia, accounting for around 60–80% of cases. It is characterized by the buildup of abnormal protein clumps, amyloid plaques, and tau tangles in the brain, leading to the gradual decline of cognitive function, memory loss, confusion, and eventually the inability to carry out daily activities. Vascular dementia occurs when there is a reduction in blood flow to the brain, typically due to strokes or small vessel disease. Symptoms can vary depending on the location and severity of the brain damage, but may include problems with memory, reasoning, judgment, and motor skills. Lewy body dementia, LBD is characterized by the presence of abnormal protein deposits called Lewy bodies in the brain. Symptoms can include fluctuations in alertness and attention, visual hallucinations, movement disorders, similar to Parkinson's disease, and cognitive problems such as memory loss and confusion. Frontotemporal dementia, FTD, is a group of disorders caused by the progressive degeneration of the frontal and temporal lobes of the brain. It can lead to changes in personality, behavior, and language, as well as problems with executive function and social cognition. Unlike Alzheimer's disease, memory loss may not be a prominent early symptom of FTD. Mixed dementia. Mixed dementia refers to a combination of two or more types of dementia, most commonly Alzheimer's disease and vascular dementia. It presents with symptoms characteristic of each type involved. Parkinson's disease dementia, PDD. Some individuals with Parkinson's disease develop dementia as the disease progresses. PDD is characterized by symptoms such as cognitive impairment, memory loss, and executive dysfunction in addition to the motor symptoms of Parkinson's disease. These are just a few examples of the different types of dementia. Each type has its own unique features, progression, and underlying causes, and it's essential to obtain a proper diagnosis to guide appropriate management and treatment. While there's no guaranteed way to prevent dementia, there are steps you can take to reduce your risk and promote brain health. Regular physical exercise. Engage in regular physical activity such as walking, swimming, or cycling. Aim for at least 150 minutes of moderate intensity exercise per week, as it can improve blood flow to the brain and promote the growth of new brain cells. Healthy diet. Adopt a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit your intake of processed foods, saturated fats, and added sugars. Some evidence suggests that the Mediterranean diet, which emphasizes plant-based foods, olive oil, and fish, may be beneficial for brain health. Mental stimulation. Keep your brain active by engaging in mentally stimulating activities such as reading, puzzles, learning new skills, or playing musical instruments. Challenging your brain regularly can help build cognitive reserve and reduce the risk of cognitive decline. Social engagement. Stay socially active by maintaining relationships with friends, family, and community groups. Social interaction can help reduce feelings of loneliness and depression, which are risk factors for dementia. Quality sleep. Prioritize getting enough high-quality sleep each night, as sleep plays a crucial role in brain health and cognitive function. Aim for 7-8 hours of sleep per night and establish a regular sleep schedule. Manage chronic conditions. Control and manage chronic conditions such as diabetes, hypertension, and high cholesterol, as they can increase the risk of dementia. Follow your healthcare provider's recommendations for medication, diet, and lifestyle changes. Limit alcohol consumption. Drink alcohol in moderation, if at all. Excessive alcohol consumption can impair cognitive function and increase the risk of dementia. Quit smoking. If you smoke, take steps to quit. Smoking is associated with an increased risk of cognitive decline and dementia. Manage stress. Find healthy ways to manage stress, such as relaxation techniques, meditation, yoga, or spending time in nature. Chronic stress can have negative effects on brain health and cognition. Stay physically and mentally active. Engage in activities that challenge both your body and mind, such as dancing, gardening, or learning a new language. Variety in activities can stimulate different parts of the brain and promote overall brain health. While these lifestyle factors can help reduce the risk of dementia, it's essential to remember that genetics and other factors beyond your control also play a role. However, adopting a healthy lifestyle can still have numerous benefits for overall well-being and may help support brain health as you age. While there is currently no cure for most types of dementia, early diagnosis and appropriate management can help improve quality of life, slow the progression of symptoms, and provide support for individuals and their caregivers. Treatment may include medications to manage symptoms, lifestyle modifications, cognitive therapy, and support services such as counseling and caregiver support groups. Thank you for watching today's video on the signs of dementia. We hope you found this information helpful and informative. Spread awareness, share this video, seek support. If you know someone who could benefit from this knowledge, please consider sharing this video with them. Together, we can spread awareness and support those affected by dementia. Don't forget to subscribe to our channel for more health tips, resources, and discussions on important topics like dementia. Thanks again for watching. Take care.